So my project is called Navigating Healthcare Gaps in Developing Countries. And for this project, I wrote a research paper where I kind of went through the links that the healthcare disparities in developing countries had in common with ventricular and atrial septal defects. So this is kind of my agenda page. First, I'm going to do an introduction and then go over topics, an overview, and then at the end, there can be questions if anyone has any. So my name is Sarish Malik, and I'm 17. I'm a senior. I live in Houston, and my mentor is Sharon. She lives in Michigan, and she's a pediatric doctor. So the reason I chose to do this project is because I've always been passionate about healthcare, and I take a lot of healthcare classes, and I really wanted to just kind of focus more on the gaps of healthcare in developing countries, and more specifically on pediatrics, because I like working with kids and it's always been something I was interested in. So I kind of sat and thought about why there's so many gaps with healthcare in developing countries, more specifically like in Asia. I noticed they don't have a lot of prenatal and postnatal care, so I wanted to kind of discover how that could contribute to congenital conditions and congenital defects. So for this project, I decided to do a research paper, and mostly all of the information that I gathered was through online research and real case studies. So some important terms, a congenital heart defect is a birth issue pertaining to the heart that a baby is already born with. So this condition they're present with at birth. An ASD is a hole in the upper chambers of the heart, so the atrium, and a VSD is a hole in the lower chambers of the heart, so the ventricles. And some methods to detect this at birth can be an echocardiogram, which is a scan of the waves of the heart and the nearby blood vessels. This can kind of detect if there's any abnormalities within the heart, and also a newborn checkup. So some effects of ASD are increased blood flow to the lungs. So in the normal heart, there isn't any mixing of oxygenated and deoxygenated blood, but in the atrial septal defect, there is a hole which causes oxygen-rich blood and oxygen-poor blood to kind of flow to each other. And this extra blood can overwork the lungs, kind of causing a strain on the lungs and the right side of the heart, which causes enlargement. And this could potentially lead to heart failure over time. And some irregular heartbeats are also a condition. These are called arrhythmias, and people with ASD may develop an abnormal heart rhythm as they age. And some ASDs are small and may close on their own, but larger ones could require medical care, professional medical care, such as surgical intervention or other treatment processes to prevent long-term health problems. So the main issues in healthcare that I navigate through my paper are a lack of specialized medical personnel, so a lack of doctors, infrastructure, buildings, equipment, and training and retention challenges, socioeconomic factors, and financial barriers to healthcare access. So kind of where the money problem is. So some key factors are, like I mentioned, the lack of medical personnel. So there's a limited availability in training programs, which means there aren't enough residency spots and training programs for every single doctor who wants to pursue prenatal or postnatal care. So because of the insufficient number of medical schools and residency programs, there's only limited numbers of slots. So not everyone can have a guaranteed spot for what they want to specialize in. So for example, someone who would want to specialize in neonatal care, there isn't 100% guarantee that they could. There's also geographical disparities, such as an urban versus rural distribution of healthcare professionals. So, for example, if in India there was an urban setting with lots of infrastructure, lots of buildings, and lots of equipment, if you go to the next rural distribution setting, there probably would be a lack of, because it's all centered in one area. So, like I said, high concentration in certain regions could lead to shortages in others. And there's also a high demand and low supply. So an aging population is demanding more of an increase for demand in specialized care and a slow growth in number of trained specialists. So there's simply not enough specialists and not enough equipment to meet the needs of a population that is growing so rapidly. Some other things are a delayed diagnosis, which is worsening symptoms and preventable complications, life-threatening conditions, and untreatable conditions. These can all get worsened over time with a delayed diagnosis because we're the doctors, or we could be ignorant about and unaware about the condition that someone is suffering just because we haven't diagnosed them on time. There's also a lack of follow-up care, which can result in a patient developing congestive heart failure due to progression of the defect, which could have been managed earlier with a diagnosis or more intervention. And there is inadequate surgical intervention, which raises the risk of heart problems. So although there is a sort of risk, there's always a risk with surgeries, and there's never like 100% or a 0% fatality rate. It's more risky to not treat the condition. So understanding patients and more problems that I noticed when researching, the main sort of patient or person who's affected by this are mothers who lack access to prenatal and postnatal care. So when they're pregnant, they don't get checkups or proper exams to sort of understand how their health is and how their baby's health is. Additionally, there's also sometimes lack of tertiary level of care, so specialized and advanced treatments, so specialized surgeries and sort of medicine that they can have. There's also an ICU and a NICU, which is an intensive care unit, and a neonatal intensive care unit, which is not readily available to lots of patients in developing countries. And inaccessive checkups contribute to a baby's well-being. So again, prenatal and postnatal care is very important. And with that, there's always sort of a risk if someone has ASD or VSD and they're unaware of it. And some disparities: missed early detection, so lack of prenatal care can prevent early diagnosis in ASD through screenings. Increased birth complications, unmanaged maternal health issues, and lack of specialized delivery care can raise risks for babies with ASD. Additionally, there's delayed postnatal treatment. So without any healthcare access, like critical interventions such as critical care that they need and monitoring after birth that they may not have access to and could be missed, worsens the baby's condition over time until it's ultimately too late to give any care at all. There's also a high risk of severe complications. So untreated ASD can lead to, again, problems with the lung causing a strain on pumping blood, and pulmonary hypertension, heart failure, and growth issues. So it's not just their heart, it's other conditions too that could be affected. There's also poor maternal health, which is an unmanaged maternal conditions during pregnancy can worsen the baby's overall health. So for example, if the mother isn't doing well and they're struggling with something that they can't get care for, that could worsen the baby's overall health, especially if they are with ASD. So that's pretty much my presentation, and that's my email. If anyone has any questions or anything, they can ask.
Awesome. This is really, really great, Sarish. Thank you so much for your presentation. I actually had a quick question. So this is obviously a very important and it just an important topic for overall, women's health and also babies' health, and something that's particularly important to me because I actually just had a newborn not too long ago. And I'm actually curious, has this research project changed how you think about what you might want to major in or what you might want to do in your career? Like, do you think you want to go into medicine? I'm just curious your thoughts on that.
It definitely has made me kind of change my perspective a little bit because I was ultimately really interested in pediatrics, which is for kids. And then after this project, I kind of realized there's so many levels of complexity to do with neonatal care. So neonatal care is actually different from pediatrics in a way because they deal with the baby before it's born. So that's definitely something I kind of switched off to in my interest when I was researching this project, and I definitely do want to study medicine, but things can change, so I'm not 100% sure yet. So, yeah.
Great, thank you. And we also had a question from Anushka for you. Do you believe that developed countries have a responsibility to contribute to healthcare in underdeveloped or developing countries?
Absolutely. I think developing countries or an already developed country should definitely put in more care and help towards underdeveloped countries in kind of funding. And there's just so much that they could do to contribute to healthcare. Like, for example, there are a lot of fundraisers and donations and charities that are constantly being held. And I was talking about this with my mentor, and we think that it would be really important for medical students to kind of have sort of a gap year where they would go and study in underdeveloped countries just so that they can help. And we think that that was a really good idea. So, yeah.
Awesome. Well, thank you so much.